Good evening one and all. Today I am going to present on the topic of impact of yogic practices on back pain intensity and flexibility among middle-aged women. Introduction. Back pain is one of the most common musculoskeletal problems affecting adults across the world, and it is a major cause of discomfort, reduced mobility, work absenteeism, functional limitation, psychological stress, and reduced quality of life. Among women, especially in the middle-aged period, back pain is frequently associated with postural stress, sedentary lifestyle, household responsibilities, occupational strain, hormonal changes, reduced muscle strength, obesity, poor flexibility, emotional stress, and lack of regular physical activity. And back pain is one of the most common musculoskeletal problems worldwide, especially among middle-aged women. This group faces unique risks due to postural stress, sedentary lifestyle, household and occupational strain, hormonal changes, reduced muscle strength, obesity, poor flexibility, and emotional stress. Back pain affects daily activities, emotional health, and quality of life. And yoga offers a holistic solution by improving spinal flexibility, posture, muscle strength, relaxation, stress regulation, and functional confidence. This study evaluates yoga's impact on back pain using standardized outcome measures, visual analog scale, Aussie disability index, sit and reach test. And the statement of the problem. Back pain is one of the most common musculoskeletal disorders, especially in the middle-aged. The risk is particularly high due to postural stress, sedentary lifestyle, household and occupational responsibility. And main is hormonal changes and reduced muscle strength. Without addressing its multidimensional nature, involving physical, functional, emotional and lifestyle factors, we cannot give any treatment to the back pain. There is a limited systematic evidence on the effectiveness of yogic practices in reducing pain, disability and improving flexibility among this population. Here the main aim is to evaluate the impact of yogic practices on back pain among middle-aged women by using standardized outcome measures. The objective of the study is to assess baseline pain intensity among middle-aged women, and to assess the baseline disability due to back pain among middle-aged women, and to assess the baseline flexibility among them, and to evaluate the effect of selected yogic practices on pain intensity, and to evaluate the effect of selected yogic practices on disability due to back pain. And to compare the post-test scores of the yoga group and control group on pain, disability and flexibility to determine whether an 8-week yoga intervention produces significant improvement in back pain related outcomes among middle-aged women. The hypothesis, research hypothesis is one, yoga is to reduce pain intensity, and the second is disability, and third to improve the flexibility, and the fourth, the yoga group will show more improvement than the control group in pain, disability and flexibility after the intervention. And the literature review is in the Iyengar yoga studies on chronic lower back pain. It has been mentioned that have improvements in pain intensity and health related quality of life by doing some the effective asanas are Tadasana, Trikonasana may support postural awareness, while Setu Bandhasana and Bhujangasana may improve spinal support. This review supports the therapeutic relevance of carefully selected asanas for back pain and highlights the importance of safe instructions. And these are some of the studies. They have showed that back pain has been reduced through some of the practices. The research gap is identified gap and justification. Existing evidence. Classical and contemporary studies have shown that yoga is effective in reducing pain and disability in chronic low back pain. Most research has been conducted in general adult population with outcomes measured using tools like the visual analog scale, Aussie disability index and flexibility test, that is sit and reach test. And identified gap. There is a limited systematic evidence specifically focusing on middle-aged women, a group uniquely vulnerable to back pain due to hormonal changes, reduced muscle strength, household and occupational responsibility and emotional stress. Few studies have comprehensively addressed the multidimensional nature of back pain in this subgroup using a structured yoga intervention. And the justification for the study is middle-aged women represent a high-risk population for back pain. And this provide evidence-based validation for yoga as a safe, cost-effective and holistic intervention tailored to women in this yoga group, in this age group. The study's use of standardized outcome measures ensures reliability and comparability with global research. Findings will contribute to yoga therapy, rehabilitation and preventive health programs. The research design is type experimental study with pre-test and post-test design, and the approach is quantitative intervention-based evaluation of yogic practice, and duration is fixed intervention period 8 to 12 weeks. The sample is middle-aged women, that is 45 to 59 years with back pain, and the sample is determined using power analysis for adequate statistical validity. And the sample method is purposive sampling from yoga centers. Inclusive criteria is women with self-reported or clinically confirmed back pain able to participate in yoga. Exclusion criteria is women with severe spinal pathology, recent surgery and contraindications for yoga practices. And these are the variables: independent variable, dependent variable, control variables. In the independent variables, yogic practices are asana, pranayama and relaxations with the breath work. And dependent variables are pain intensity and functional measures, flexibility. And these are some of the dependent variables I have mentioned. Control variables are age, BMI, lifestyle factors, baseline pain relief. And yoga intervention, yoga program, selected asanas with breath work, pranayama and relaxation techniques tailored for back pain. Some of the asanas like Tadasana, Marjariasana, etc. And the frequency is 3 to 5 sessions per week. Duration is 45 to 60 minutes and supervision conducted under guidance for trained yoga therapist. The statistical analysis is descriptive statistics, mean, standard deviation for baseline and post-test scores. Inferential statistics, pair t-test, independent t-test and effect size estimation. The breath. And I have given the breath, abdominal breathing has been more effective for these back pain claims. Okay, recommendations are selected yogic practices may be recommended as a complementary approach for middle-aged women with mild to moderate back pain, and yoga programs for back pain should include warm-up, gentle asanas with breath work, pranayama and relaxation, and yoga intervention should be taught by qualified yoga instructors, and middle-aged women should avoid forceful stretching, jerky movements and painful postures. Asana should be modified according to pain level, flexibility, body weight and physical capacity. Pranayama and guided relaxation may be included to reduce stress-related pain perception and muscular tension. Community centers, women wellness clinics and yoga therapy centers may introduce structured back care yoga modules. And finally, I conclude the study by that instead of doing simple asanas, by practicing each and every asanas, only through the breath work will be more effective. Without the breath work, the pain intensity will not be reduced. Only through the awareness, wherever the postures, whenever the stretch or any posture holding, the breath awareness should be there to the claim. Then only the intensity or flexibility can be improved. Thank you.